Hello, I'm Dr. Steve Edelman. I am not only a physician who specializes in diabetes, but I have also been living with diabetes for over 40 years, diagnosed when I was a teenager. I know how overwhelming it can be when you're first diagnosed with diabetes. It seems that there are so many things you have to do on a daily basis, and it is not unusual for you and your loved ones to get stressed out about this. Becoming educated is the key to living a long and healthy life with diabetes. You will be living with diabetes 24/7, and your healthcare provider can't follow you around and give you advice all day. So that is why you need to be the most important member of your healthcare team. Knowledge gives you the power to take control of your diabetes. That's what this program is all about, empowering you to live well with diabetes. Remember that diabetes is a treatable condition. We recommend you watch all 6 videos, which will cover the important aspects of diabetes care as we walk you through the diabetes management process. Now let's talk about the important aspects of diabetes management. The first is home glucose monitoring, the devices that measure your blood sugar level or glucose level at home that tells you and your caregiver how your diabetes is doing. The reason why it's so important is because we know that if you can keep your blood sugars as close to normal as possible over the long term, we can reduce the complications of diabetes, both short-term complications like feeling thirsty and urinating a lot, to the long-term complications, which is eye, kidney, and nerve disease. Now, the other components of diabetes management include dietary issues, exercise, medications, and staying motivated and coping with emotional issues. As this video series progresses, we'll be talking in detail about these topics. First, let's focus on home glucose monitoring. What is home glucose monitoring? Your caregiver most likely prescribed to you a little glucose meter. These are little devices where you prick your finger with a lancing device, you squeeze out a drop of blood, you put it on a strip, and it tells you very quickly what your blood sugar is. Why is it important, and how often should you test? Well, first of all, it's important because we need to know how diet, exercise, and your medications are affecting your diabetes. The times per day that you need to test really depends on you and what your medications are. If you're someone with type 2 diabetes and you're on oral medications only, then you may need to test only once or twice or 3 times a week. However, if you're on insulin and you adjust your dose based on your blood sugar, you will need to test much more frequently. Now, in terms of the exact times of the day, we commonly ask our patients, we as doctors, before meals and 1 to 2 hours after meals. And we call this the pre-meal and the post-meal blood sugars. And depending on your regimen, those numbers will have extreme importance on how to manage your diabetes medications. What if your blood sugar levels are not at your goal? First, let's talk about hypoglycemia or low blood sugar. Typically, we define that as less than 70 milligrams per deciliter. What are the symptoms? Shaky, weak, sweaty, your heart starts to beat, we call that palpitations. You can get mental confusion, you can actually have a seizure. So it's important to be aware of the symptoms. What are the causes? Typically, you might be on too much diabetes medication, such as insulin. You may have over-exercised. You may not have eaten as much as you normally do. So these are some of the things that can cause low blood sugar. What are the solutions? Of course, if you have a low blood sugar, you always have to be prepared to have some fast-acting carbohydrates with you, whether that's glucose tabs, glucose gel, a can of regular soda, some regular fruit juice. If you're on a medication that can cause you to get low, such as insulin, you've always got to be prepared for that. It's also important to record the time of the day that you get low. This is extremely important for you and your caregiver to discuss so you can avoid these situations in the future. Now let's talk about high blood sugar, also called hyperglycemia. In terms of the goals for high blood sugar, we have to separate out before meals and after meals. Typically, if your blood sugar is below 130 to 140 before eating, that's typically a pretty good first goal. We try to keep it below 180 to 200 1 to 2 hours after eating. Now, this is individualized once again, and it also depends on what level you start off from. If your blood sugar is 180 to 200 before you start to eat, you can't expect it to be at that range after you eat. So we typically try to keep the blood sugar from going up 50 to 80 points from the baseline. Now, what are the symptoms of high blood sugar? Here's the problem. High blood sugar really doesn't cause too many symptoms. So people can walk around for months, years, hours, whatever, and not feel that bad. And we know that high blood sugars over the years can lead to complications. And that's just another reason why it's so important to have a home glucose monitor and test your blood sugar regularly according to what you and your caregiver decide. Now, what are the causes of high blood sugar? Once again, you have to look at your dietary issues, if you've eaten too much, or you accidentally ate something in your diet that was caloric dense. Maybe when you go out to a restaurant and you don't really know the calories in what you're eating. If you're a regular exerciser and you don't exercise. If you're on other medications that can affect your blood sugar. And if you have other illnesses, if you have a cold, typically your blood sugars will be higher than usual. And lastly, but not least, is emotions. Stress in and of itself can raise your blood sugar, but also stress, anxiety, depression can affect the way you take care of yourself, and that secondarily will affect your blood sugar control. So I think the solutions are many, and the first step is identifying the cause of high blood sugar, and then you can talk with your caregiver to try to figure out how to avoid those situations in the future. We'll be back with more information about managing your diabetes, but first, let's pause for a brief quiz to help you remember some important aspects of taking control of your diabetes. In addition to testing your blood sugar, there are other types of lab tests that you should have on a regular basis. These are related to the ABCs of diabetes management. A stands for A1C and aspirin. Let's talk about the A1C first. It's a simple blood test. Your caregiver should get your A1C every 3 to 6 months, and it tells us what your average blood sugar has been over the prior 2 to 3 months. You can't test your blood sugar every hour for 24 hours for 2 to 3 months, so it's a really important lab test. The American Diabetes Association puts out guidelines. Where should your A1C be? So, for example, they say that it should be 7% or less. And what does that mean? It tells us that your average blood sugar, if you tested that frequently, would be, on average, 150 milligrams per deciliter. And once again, your A1C goal, like any other goal, has to be individualized. It may be different depending on your age, if you have heart disease, if you don't recognize your low blood sugars as well. So there's a whole list of issues that we look at when we determine what the goal should be. Now, A also stands for aspirin. Aspirin is a blood thinner. And if you're not on aspirin, I recommend that you talk to your caregiver the next visit and say, should I be on aspirin? This is something very important that you need to discuss with your caregiver, because some people are allergic to aspirin, certain people are on other blood thinners, and you don't want to take two at the same time. B is for blood pressure, and C is for cholesterol. So let me just say up front that blood pressure and cholesterol control are the two most important factors that determine your risk for having a heart attack or a stroke. So it's just as important to measure your blood pressure and cholesterol levels as it is to measure your glucose levels. So that's why we call it the ABCs of diabetes care. When it comes to controlling your diabetes, education, motivation, and self-care are your most powerful weapons. Managed diabetes is not a sprint, but rather a marathon. Winning starts with a decision to educate yourself. So congratulations by watching this video. You have taken an important step in the journey to living well with diabetes. Keep watching, keep learning, and never give up. I'm Dr. Steve Edelman.